My name is Jennifer Kenger, and today we're going to be talking about cardiac catheterization lab. So what is cardiac cath lab? Cardiac is where cardiac catheterization takes place in a small operating room such as this one. Over here you can see the C-arm and a table here, and then from there is diagnostic and therapeutic catheterization. The doctor uses the catheter to gain access to the heart and injects dye into the coronary arteries, essentially an angiogram. As people age, the normal blood flow through the arteries can be affected. How does it work? When patients are having symptoms such as chest pain or tightnesses, they will cardiac problems such as narrowing of coronary arteries, blocked blood vessels. Cardiac catheterization is an insert of the catheter, which is a thin tube, into the artery. They will either use the wrist, which is the radial or ulnar artery, or they'll use the femoral artery. And then from there, they'll inject dye into coronary arteries. When that is done, the doctors then will collect information about the heart's blood supply or the function of the heart. As X-ray techs, we monitor the machine and we'll do a fluoral images. Down here below, you can see the deposits, and then they'll insert the catheter here and then put a stent in, which helps open the arteries. There are three main coronary arteries: the left anterior descending artery, the right coronary artery, and the circumflex artery. Over here is the injection of dye, as you can see all those. So what kind of tests are performed? So you have an ablation, an angiogram, angioplasty, an implantation of pacemakers or ICDs or stents may be carried out. Ablation is when they burn or create scar tissue in the arterial valves to help with the electronic signals. Angiogram is a procedure that uses X-ray imaging to see the heart blood vessels, which is very commonly done. Angioplasty is used to widen the blocked arteries, like putting in stents, and pacemakers are also common, but you have to have an interventional doctor to do that. And during all these procedures are done using fluoral X-rays, and through the catheter they can insert. So here we have a stent being placed. So this is before, during, and after. And down here we have a pacemaker. And like I said, you need to have a conventional doctor do it because they have to make an incision to where it goes. Here, so cost of exams and equipment. A normal cost of a cath lab is about $3,172 to run the whole thing. Per procedure ranges from $1,000 to $10,000 depending on insurance and all that. And the C-arm that uses the fluoral costs anywhere from $45,000 to $200,000. It's more towards the higher end because the C-arm we use in the cardiac cath lab is mounted to the floor and more powerful. And then the table cost is about $3,000. Over here we have the cost of the facility, staff, and equipment. So what kind of education do you need? You need to get your radiology technician certification in the RRT website. A lot of places will do on-the-job training, and then they set up 150 hours online classes with lab time, and then you have a certain amount of procedures that you need to do. And these are my resources. Thank you for watching.